Evening. This is Ellen Teeter. I'm the Executive Director of the Florida State Oriental Medical Association. Welcome this evening. We have Janet and Danielle here to share some really great information with us. Real quickly, if you have questions, if you can put them in the Q&A, we will try to look at both the chat and the Q&A, but let us know where you're visiting from. Hi back to Valerie, and I know Angela, and yeah, we're glad to see you here. So I'm going to let Janet and Danielle introduce themselves and their program, and we'll get started.
Well, hi, everybody, and good evening.
Hi.
My name's Janet Humphrey, and I am now working as an acupuncturist, Chinese medicine practitioner in West Palm Beach. And I previously practiced in New York City. And it was when I moved to New York City back in 2002, and I had been practicing, I'd been licensed in California, that I attended the Tri-State College of Acupuncture, of Chinese medicine. And that had been founded by Dr. Mark Seem, and he built his curriculum while basing it on TCM, as we all do learn, but he built his curriculum on meridian style palpation based acupuncture, which he had been educated in. And along the way, he had encountered Dr. Janet Travell, who, along with Dr. David Simons, they were Western medicine doctors, had elucidated the presence of trigger points in the muscles of the body. He studied with her, and he brought her to the college to teach his own students, and then he incorporated that into his curriculum, and I had the opportunity to study with him. So ever since that year, I've been working with trigger point release in my acupuncture practice. And I'm just really excited to tell you about it. And I really hope that every acupuncturist in Florida can bring that into their practice and just see how it expands what you can do and how your practice can thrive and how you can bring such great satisfaction to your patients and, better education about our discipline and the benefits of acupuncture. And I'd like to introduce Danielle, my colleague, who has been working together with me for the last several years.
Hi, everyone. I'm Danielle. I am in West Palm Beach as well, just a little bit west in Wellington. And I met Janet over 4 or 5 years ago. And as soon as she told me what she does and how she treats, I was instantly captivated. I was so interested, and I felt like I had to, or I wanted to learn it. I didn't want to have any residual fear of needling in any part of the body. And after leaving school, I kind of had a little bit of fear, especially around the organs, of course. And I wasn't really the greatest at pain. It wasn't my specialty. And it was just perfect alignment. And I've been studying with her ever since. I've been using the trigger point therapy ever since. And all of a sudden, little by little, now I'm the expert at pain in my clinic. And it's been incredibly humbling. It works. And we look forward to sharing this beautiful medicine with you. Thank you.
Yeah, thanks, Danielle.
Mm-hmm.
So I'll share my screen now. We have a little slideshow for you. And
Okay.
Yeah.
We have a request for you to turn your volume up a little. I think people at home maybe can adjust theirs, but your mic is definitely lower than Danielle's.
Okay. I'm wondering how to do that on this computer.
If you go to the audio setting on the Zoom, you click on that little up arrow and you go to test speaker and microphone.
Yeah, and I see
And then
audio volume. Okay.
you should be able to up that, but at home you should be able to up your volume as well.
Is this better now?
Yes.
Thank you. Thank you for letting me know. All right, I'll try to speak up and make everything clear. So I'm going to start by sharing my screen, and we have a little slideshow that's just going to guide the conversation and the explanation here. Okay. hold on. All right, Ellen, my Zoom, here it is.
Click on the slideshow on your
It was
PowerPoint.
blocked by my Zoom. Hi, everybody. I'm just like getting used to
Okay.
the PowerPoint display. Okay, here we go. There we go. All right,
All right.
move forward. Okay, so here we are. So we're all familiar with this term dry needling, and a lot of people wonder what is the difference between dry needling and trigger point release acupuncture, and they're exactly the same. So you can use either term to describe the technique, and I'll tell you a little bit more about that. I lean towards calling it trigger point release to distinguish it from the Western style form of dry needling. I'll tell you more about that too. So the origin of this term dry needling goes back to Western medicine, because when Doctors Travell and Simons, elucidated the presence and the locations of trigger points throughout the body, they began by using hypodermic needles in the way that they needled. They did acupuncture essentially, but they were using hypodermic needles, that's what medicine used, which has an aperture in it for either injecting fluid or withdrawing fluid. So this, since it had no fluid in, was called dry needling. And before too long, they realized that that was more painful than it needed to be, and they took up the use of acupuncture needles. And they're essentially, so there are various terms for it: trigger points, taut, tender points, but the technique can be called dry needling or trigger points. I think since we're acupuncturists, we're not dry needling, we're actually using acupuncture to release trigger points. But it's your choice. Sometimes because people are very familiar with that terminology, it's a good way to engage them and they know what you're talking about right away. So here's why I think we all should learn trigger point release as an acupuncturist, because as skilled practitioners of needling techniques, needles are our primary tool. We're used to needling, we're good at needling. We've spent thousands of hours learning it and then practicing it. So I argue that acupuncturists are uniquely positioned to deliver effective trigger point release therapies for pain management and more. We'll talk about what that more is. We use a whole person integrative approach, don't we? So we are treating the internal physiology of a patient while we have the opportunity to also do an more external treatment on the muscle layers to take care of any holding patterns or constraint there. And that's really back to our origins of treating and balancing the yin and the yang at the same time. It's just another way into that. I think and I believe that by supporting the more internal aspects of a patient's physiology, which you could group as sort of the more yin, internal, we have a better chance of our external, more yang, superficial release, holding, and being supported by the body's physiology than if you were just to take that one muscle in isolation and get it to relax. And so this is one of the differences between Chinese medicine, dry needling, and Western medicine, is that they've put it into the Western medical paradigm. And so they'll get a script for a frozen shoulder or, a pain, a sciatic pain or something, and then they'll go and needle the part that has a prescription for it, that one part. What we do is we look all around. We look at the area of pain, we look at associated regions, we look at left to right, up and down, front and back, and internal to external. So you don't have to just stay on the shoulder, because you might have the opposite hip, which is pulled into the pattern of imbalance. And you'll be palpating to find what is involved with this situation of the patient's pain and treating all of it. So you really do get amazing results. And people come away from this treatment like just blown away. I have so many people over the years, they come in as skeptics. Well, we all do, but they really go out as converts because their pain has been immediately released. And then they start telling their friends and family, and before you know it, you have a lot of word of mouth referrals. So this is it. Your patients are getting immediate results. They're extremely satisfied. That generates more referrals, and it's self-generating marketing. And you know what? It's good for your self-esteem. You really know that you've made a difference in these people's lives. And another thing I want to say about that is you don't have to worry about getting people better too fast. Like, oh, I'm going to lose a patient. And there's two main reasons for that. And one is they go around and tell everybody they know. So the multiplying effect of new patients coming in, you can't get a better marketing tool than someone's trusted friend or family member telling you how well it worked for them. You don't have to do any of the work. We are actually not in competition with the physical therapists for this market. I've thought about this a lot. When they first started doing it, or when I became aware they were doing it here, I thought, well, okay, most of us don't learn it it's not in most of our acupuncture curricula. So at least people will have access to it. But very quickly, I started having patients show up at my clinic saying, well, I went to a number of sessions of dry needling and it didn't make any difference. And I don't want to be negative, but I want to be honest. I don't think that when your primary tool is not needles, and you get a very small amount of continuing education, that you're gonna likely be the best at it. And I think you could probably really be one of those people who is very motivated and takes a lot of initiative and gets really good, but they're also constrained by the confines of how their practice is done. So I just think we have to get better at it. You know, there's an Indian anecdote from ancient India where the teacher draws a line on the chalkboard and he says to his students, you know, make this line shorter without touching it. You know, and one student gets up and he tries to erase part of the line and he says, no, I said without touching the line. So another student gets up and tries to, you know, draw an extension. He said, no. So he said, what you need to do is draw the line longer, and under that line, you know, under it, he just drew a longer line. And this is the metaphor that I have for our work. We just need to get better at it. And we're so poised to do that. It won't take much. And when we are, you know, people will gravitate towards the most effective treatment. So we are not in competition, and we don't have to feel that we are. Additionally, as you, I'm sure, all know, many people don't know what acupuncture can do. You know, if they know about it at all, they think of it only for pain. If you can get them in the door for their pain syndrome and effectively release that, while you've also balanced their inner physiology, they realize, wow, that is just stunning. Like, I have never felt this relaxed. I don't know when was the last time I slept so well. My digestion is better. And it speaks for itself, and they don't understand why or how, but they understand acupuncture is doing much more than just relieving my shoulder pain. So it gives us an opportunity to have access to these patients and really educate them about acupuncture's benefits beyond pain relief. Because not only is that great for your practice, but it's great for our profession. And it's great for people to have access to what we do and what we offer. So I think it's a great way in. Okay, so this is a little history. I gave you a little bit already. So Dr. Mark Seem had been trained in meridian-style palpation-based acupuncture. I think he originally studied in France. And he founded Tri-State College of Acupuncture. And at some point, he met Dr. Janet Travell. He was thrilled with what she had come up with. It not only synchronized with what he had learned, but it added knowledge. It added more that he could work with. So it was Dr. Travell and Dr. Simons who wrote these foundational texts, and they give not only the most likely locations for trigger points in the musculature, but what might have caused it, what are the perpetuating, you know, factors, how do you release it, and how do you take care of it afterwards with stretches and exercises and lifestyle, ergonomic changes or whatever it may be. Dr. Seem brought Dr. Travell in to teach his own acupuncture students, and then he incorporated it into his core curriculum and developed what he then called acupuncture physical medicine. And so I got to learn from him due to this glitch that made me go to acupuncture school in New York for a year after I moved from California. You know, it was like an administrative requirement. And I spent that whole year learning from him, and it's just like revolutionized how I work. And I hope it will do that for you as well. So here's a little bit about trigger points that you may or may not know. And there's a lot to know. But the basic definition that Janet Travell, Dr. Travell, and Dr. Simons gave was that a myofascial, so myofascial is the muscle and the fascia in relationship and in combination. So the connective tissue in and around a muscle. A myofascial trigger point is a hyper-irritable spot, usually within a taut band of skeletal muscle, which is painful on compression and can give rise to characteristic referred pain, motor dysfunction, as well as autonomic phenomena. You could have a trigger point in your upper back and it's giving you tingling in your leg. That's part of what that is meant by that. And here's a little, like a close-up. Oh, what happened? What did I do? A close-up of that. So here's like a taut band right here. And then this is a central trigger point. And within that, sorry, it keeps changing the page. Within that, you have like other little contraction knots. So when you go with an acupuncture needle to release a taut band within a muscle, you're going to find multiple spots to release to fully relax that area. It brings up the question, a pretty obvious question, is this what was historically known as, or some of what was known as Assure points? Because that definition was any point which elicited pain under pressure, and acupuncture could treat that. And that is what these are. And yes, Dr. Janet Travell discovered it in modern times. It didn't really carry through from ancient China, where probably, or how they did Assure points way back when. It really didn't carry through in that way to our, I don't think, to our modern acupuncture education. Dr. Travell had noticed, one of the things she noticed along the way was that she did heart surgery on a patient. She knew that heart was fixed, but afterwards they would tell her they still had pain in their chest. And she found active trigger points in the chest wall. And once she released those, that chest pain was gone. Now this led her to understand the relationship of the, what she calls viscerosomatic pain or somatic visceral pain. The relationship between tension in the musculature and dysfunction in the underlying organs. So in her case, when she healed the heart organ by surgery, the muscle over it had been affected already and it wasn't letting go of its trigger points. Conversely, we can release trigger points that are located around and over an internal organ and improve the function of those internal organs. And this is part and parcel of how we work. So if you can get those active trigger points released in patients that have internal problems, you're going to get even better results. Here's some examples. We all probably see a lot of fertility patients. They often have active trigger points over the lower abdomen and pelvic regions, which when you release it, improves the circulation, improves the function, and can turn things around for them really fast. Same with digestive problems. You'll find maybe the mid to upper abdomen or back of the torso, anywhere that wraps around those organs. When you release those trigger points, those symptoms can improve. Same with lung or heart patients like Dr. Travell had. And headache and migraine patients, those can be tough ones, especially migraines. But they often have active trigger points in the neck and occipital regions, and sometimes in the head as well, like over the scalp or so on, that when you release them, their headache is completely resolved. I've had migraine patients that suffered for life, and then after having several acupuncture treatments with trigger points report that they no longer have migraines. That isn't all migraine patients though. I'm not going to promise you the moon, but it does help a lot of patients to recover, and it helps other patients to get much better. You know, so you're not just relying on Li4 and liver 3 kind of thing. So here's something about how we can incorporate acupuncture, this trigger point method, into any other system that you use. Doesn't matter. It doesn't matter if you're using, I think probably most of us here in Florida are using TCM based, but there are also 5-element schools. So whatever system you're using to balance that person's internal physiology, you continue to use it. And only in rare cases would you just release a trigger point by itself. You would always want to do it in the context of an overall treatment for the patient. So you may either insert those distal points to balance a patient and then leave them in while you find the trigger point, or just do those distal points initially and then, take them out and do the trigger point, especially if you need to reposition a patient. But you would use both. We're going to go over this more in the class that we're teaching how to do this. So when you find the trigger point, it's going to be a matter of asking the patient where their pain is. And you will have observed the patient, you will have gotten their symptoms, and you would have, already understood a lot about it. So let's say it's in their upper back or shoulder area. You palpate that area and you'll be able to feel the taut muscle band. And when you get what we call a twitch response, like a ropey sensation where the muscle jumps under your fingers, you have a trigger point that's active. In order to needle it, there's a very different technique than we've ever used in acupuncture. So you're going to want to trap that muscle with your one hand, the hand you're not using to administer the needle, so that it doesn't slip away from you when you put the needle in, right where it is. Then you insert the needle into it, and you don't just leave it there. You actually use a little pecking technique into it and around it. You might move it in different directions here and there, and you'll feel, when you feel that twitch, which is very noticeable, the patient will feel it and you will feel it, and you can often see it on the surface of the body, you've got the trigger point. As I showed you before, within a given trigger point, you may have other contraction knots. So needling one point might involve a number of twitch responses. When you feel you've got enough of those, you kind of bring the needle out more superficially to ensure that it's not going to come in contact with any internal organs. It's hugely important, our safety in this technique. And you leave it in. You leave it in for a bit of time. We ordinarily will leave our needles in for, the standard teaching is like 20 minutes for an overall treatment minimum to get the assimilation we're looking for. I usually don't feel like trigger point needles need to be left in that long, but I do find that leaving them in for, at least 10 minutes is good, because you will often get further release upon taking it out. And that's good. And it's not like waiting 10 minutes, because if you're working on one muscle and then you leave the needles there and now you go to a different muscle group. Okay, yeah. So I just really want to emphasize that with this technique, we have to be really aware of the safety concerns. Like if you decide to listen to this presentation tonight and go try it, the one main thing I want you to take away is it's just vital to master the proper technique to avoid injury over the organs, and especially the lungs. Like when you're doing the upper trapezius, you must grasp it in your hand to keep it up and away from the lungs, which in some people can come right up under that muscle. And we all learn, it's like day one in acupuncture, like avoid pneumothorax. So you really have to do it. And when we go through all of the muscle groups, we're going to be talking about the safety precautions in all of those areas. But you have to learn how to keep your needle safely away from all the organs, nerves, and arteries. And that's, straightforward to learn, but it's different from how we do it. It's not different. We're still needling, but in our ordinary needling techniques for meridians, we don't usually go that deep and we don't peck around. So I have actually, as I told you, many patients who came back from so-called dry needling in a physical therapy setting reporting no benefit. I was disappointed at first, but now I'm excited because we can all, hopefully bring it into our practice. I keep seeing where Western medicine, like the Mayo Clinic and different really well-known sites on their website say dry needling is not acupuncture. And I guess it's true in the sense that they're not using the whole system of Chinese medicine at all. They're just isolating, they're doing it in a Western medicine way, but they are using acupuncture needles in their treatment. So I don't know if that claim really, I don't know why they're making that claim. I think they're doing it, I feel as though they're doing it to make it like, well, this is real medicine and acupuncture is not. So I dispute that. All right, so I went through that pretty fast. And now I just want to see what you've thought, what you've taken in, if you have questions or anything that wasn't clear. I guess Ellen, will you moderate that or people come on? I don't know where Ellen has gone. Let me get out of this screen share.
I'm trying to get unmuted, sorry. Yeah, if people want to talk, you can raise your hand. If you want to just put something in the Q&A or the chat. We do have a question, where are you teaching?
So
we,
okay,
yeah.
so we're doing an initial seminar, and this is an initial seminar, so there'll be more. But basically, right now our curriculum has 3 different weekend seminars, and the first one and you can't do the whole body in 2 days. So the first one we're doing, it's at the end of September at Atlantic College of Oriental Medicine in Fort Lauderdale, and it will be Saturday and Sunday, the 27th and 28th. And we're going to cover the upper back, the muscles of the upper back and neck, and backside of the shoulder. So these are some of the main muscle problems that people come in with, whether it's headache, frozen shoulder, just back pains, head can't move, stiff neck. So that's a good way to start. And then we're going to do subsequent ones that cover the lower back, which will include sciatic syndromes and leg and runner's problems and knee problems. And then the head and the front of the neck. That takes its own seminar because that's, there's a lot there. So that's it. The first one is the end of this month.
Okay, we have Angela Middleton has her hand raised. I'm going to allow her to talk, and then somebody who's wanting to know the cost of the workshop. So, but Angie, if you can unmute yourself.
Okay, can you hear me?
Yes.
Yeah.
Okay, well, I wasn't sure how to unmute myself when I raised my hand, so I started typing in the chat. So I'll just go ahead and say what I was going to type. I love the statement that you made that treating the skeletal muscle helps to make the organ underneath healthier. I just think that is so fantastic.
Yeah.
I really love that.
It's really amazing. And it's just like, it really opens whole new doorways, right, to healing.
Yeah.
Yeah. And it's very consistent with our paradigm that we already have. That's cool.
I also really like how you incorporate, the distal points and not just the trigger therapy.
Yeah, it really stays consistent with our medicine, like our holistic, whole person medicine. The beauty of our medicine is so profound, and we sometimes overlook that in our efforts to explain acupuncture to Western American patients. Like, it's a far stretch to talk about yin and yang and qi and all of that, but we can talk about, structure and function or like fertility and just symptoms, but our medicine has so much more to offer. But we can't teach them by talking about it, but we can utilize it in such a way that their response and their experience is as beautiful and profound as we know that our medicine is.
Thank you.
Thank you, Angie. Somebody
have a question. Would you prefer a motor point with manual E-stim at 10 hertz, trigger point release with manual E-stim at 10 hertz, or both? It's an either or question, sorry.
All right, so that's interesting. I have done a little study of the motor points with Matt Callison, and I think that that's a very useful approach. And I think what it is, each one of us is going to get our bag of tools together. There's so many approaches to acupuncture. And I took, as a matter of fact, Matt Callison offered that course at Tri-State, as a continuing education class, and he teaches quite a lot, and his work is brilliant. I think you could work with what you're drawn to, and it might be a great idea to combine the motor points with the trigger points. It wouldn't be wrong to do that. I'm drawn to the trigger point more because I get a feedback loop that really works for me, and I can go like, oh, that's better. And I don't use much e-stim in my practice because I think that the manual stimulation of the needles on trigger points makes that unnecessary. But again, it's your option, your choice. Did I just see something about the cost? Because I think it's $325 for the, right, Danielle? It's $325 and then we have an early bird, which is 10% off up until Monday. I hope it's well.
The note says early bird is $325 through September, and the link, Danielle put it in here. Acupuncture Trigger Point Seminars.com gets you to the class to look at the class.
Yeah.
And also on the FASOMA website under live online events, we do have a link to your class.
You can look it up there, but I might be wrong, but I thought it was $325 full price, and then there's a 10% discount off of that with the early bird. I think so. And I can even double check that on our website. So we really wanted to make it accessible. And I actually have noticed that a lot of these classes are getting very expensive. But I really want you guys to learn it.
Yeah, I had just recently, I remember Mark Seam's book from 15, 20 years ago.
Yeah.
And I just recently had ran across somebody else that had studied with him. And so it's interesting. His work originally was interesting, and I had no idea he had then added the trigger point in. So
Yeah, and he's written some books, but I have two of them that I really love. If you want, I can just put them in the chat because they're fantastic to read. One of them is, if I can get it on the camera. Oh, is it backwards? Yeah. A New American.
No, not for me.
Okay. A new American acupuncture, and he just termed it, acupuncture osteopathy, which was referring to the fact that you can touch all the levels, the internal, the external, the fascia, the muscles, and the organs and everything. This gives a really nice explanation of how he taught it. And he did come up with his own protocol, which we're not going to focus on in this class because that would take a whole class of its own. And that's why I say you can use whatever approach you're already using. He had his way of addressing the internal physiology, and so he had like a protocol for that. And it's fun. It's great to learn at some point if you're interested. And it's in his book.
I wanted to comment, I said it in the chat, when you see a news article about a problem from dry needling, they call it an acupuncture needle.
Yeah.
So even, it's not good reputation. Angie has another question. Angela. Sorry, Angela. Go ahead.
She's probably unmuting.
Oh, am I unmuted?
Yes.
Yeah, you're good.
Okay. So when you were talking about grasping the muscle that you find that's very taut, how do you decide which part of the muscle is the central part that's the problem and that's the part you trigger? Is that something I have to wait and take your class to find out?
The best way, honestly, to do that is through practice and example. Like if I tell you, I will tell you, but nothing's going to match your hands-on experience of feeling for it. And over the years, I've just taught a fair number of acupuncturists in my, as interns in my clinic. And I forget, because I've been doing it so long, how we need to cultivate these palpation skills, because most of us haven't really done that kind of palpation. We've done palpation of pulses. Some of us have done the Hara palpation. We've done meridian palpation and point palpation. But this is like, if I come over to your trapezius, your upper back, I'm going to bring my hand, I'm going to grasp that whole body of muscle. In what we will learn in the class, and what you can learn from Dr. Travell's, textbooks, is there are typical locations for trigger points to be found in each muscle. But you can also look around that location because it's not set and fixed for everybody. But that she mapped out the whole body, all the muscles, and where the most typical locations are. So when you have a sense of that and you grasp that muscle, and then you feel it, you're going to be, oh, that is very taut. And the patient will say, oh, yeah, I feel it. Then you might do a little bit more specific palpation along the band until you go, oh, that one's the tightest. Or that one, when you run your thumb over it, it twitches, it really jumps. And that's how you know that you're on a very important trigger point to release. And so one of the factors here is we don't usually learn the anatomy of the muscles. I didn't really learn it to this depth until I studied with Dr. Seem and practiced over the years. And one of the fun things too is once you get that feel for the palpation, like if you took seminar 1 on the back and the neck, you would have a really good introduction to what that palpation experience is like. So even if you haven't learned the specific finding the muscles for the sciatic pain, you do know how to do the palpation, and you can start to apply that in your practice. Over the years, your practice will teach you more and more, but that's it. You find and you look for the taut band and it will show you because it twitches. And the patient will say, I feel that.
Okay, thank you.
Yeah.
Any more questions about the class, about the technique? I was wondering, I mean, I have a tight band all along here, some from mousing, I think. And I can sometimes feel a spot that's a little sharper, but also I feel like sensation up into the neck.
Yeah,
So would that,
yeah, that's known as referred pain. Yeah.
okay.
So when you release that trigger point where you have it up here, you may actually, while the trigger point is being treated, it may replicate that referred pain. Like you'll go like, oh, I feel that all the way up to my neck. And ultimately, once the trigger point is resolved, that referred pain goes away. It's referred. It's coming, like some of the pain comes from the shoulder all the way down the arm into the hands. And there's nothing going wrong in the arm itself. And we learn about that. We learn about referred pain and you begin to, as you practice it. So learning the technique and the tools is number one, and the musculature. That's where I started. We don't learn that kind of anatomy. It's not our focus, really. We take an anatomy class as a prerequisite, but we don't really go into the muscles. And the muscles and the direction of the fibers, this is also to Angela. We always do what we call a cross fiber palpation to identify the trigger point. So if the muscle is going this way, we palpate across it. That's the way you're going to find it, and that's also the way you're going to needle it. So in order to do that, you do have to get to know, or even have your book handy, in what direction are those fibers going. Oh, Angela's back you're in the chat?
Yes.
When doing the pecking motion, do you withdraw the needle part of the way?
Yes, you do. And you'll do you'll have the muscle here and you're probing. You'll get to know because you feel the firmness of that trigger point under your needle in your hand. And you'll also know when it's got kind of winding up to release, and then you'll feel it release, and that's just and so as you're pecking, you're doing this in and out motion, which I think when Danielle started, that's what she saw was one of the new aspects of needling with this technique. We don't do that. We might turn it but we don't do this particular kind of exploration as we do in trigger points. And when you're when you're done releasing that area, instead of taking the needle all the way out, you bring it up much more superficially, like over the muscle, more or less. So that, because if you leave it in that muscle, the muscle can suck it down deeper. And you really don't want that. But by keeping it in place over the muscle that you've just released, it's still, there's still an effect that's being continued until you do take the needle out. And what I always do is just hold it again and a little pecking motion one more time before taking it out, because that often lets you have more release from that. And I know really good practitioners who just take it right out as well, but that's not how I learned it from Dr. Seem.
Okay.
So if you're able to join us, we would love to have you. It's going to be really fun and very active and engaging and hands-on. So we'll go over the muscle groups that we're treating and the sort of typical referred pain, and we'll be up and on the tables and learning the palpation, and we'll be practicing the trigger points, and we'll be doing it on each other. So you can have the experience. One of the really important things is having the experience of trigger points released in your own body too. Got to know what that feels like. So we'll do it on each other. And like Ellen just said, nobody doesn't have tight shoulders. We're going to find that in most people who work hard and study and work at computers. So we're going to find trigger points that you may not even know you have. You may not have a pain syndrome. And we're going to go over this too. Like, there are active trigger points that cause a known pain syndrome, and there are latent trigger points that are there, but they're not yet activated to the point of causing a pain syndrome, but you could still find them and release them. So we can find them on each other. And you'll come home. And by the way, after doing a trigger point treatment, the person will feel, or you, if you've had one, really sore in that muscle. Like it's been, like you've just lifted weights at the gym. You know, when you go to the gym and work out, the soreness might come 24 hours later or something, but this is immediate. So they get up off the table and they have, ooh, wow, that's really sore. But they've traded the pain of the tight muscle for this sore after effect of the treatment. And you explain to them what to expect, what to do, what it should wear off within a day. And they kind of already like that a change has happened, but it will be sore.
Could you show that screen again that talks about the seminar?
Yeah, I was doing that, so I'll do it again. Is this one?
Excellent.
Yeah. And this is on the FOSOMA website. You can find it there with the link to go to their website.
Yeah, it'll describe the seminar and, offer you the opportunity to register. And if you choose to do it, I would just say, see if you can grab it by Monday, by the end of day Monday, so that you can get the discount.
I think I'd really like to do it the first of the year because I have all my credits for this two-year period.
Okay.
Here, I'm gonna.
I want to do, by the way, sorry, what we want to do is also, I was thinking this through so that we don't have to, there are 3 courses and the fundamentals are taught in seminar 1. What I'd like to do is make that, like, some of the content from seminar 1 available via an online webinar, so that if you take that webinar, you can come straight into 2 or 3. You don't have to do them sequentially, because that might really draw it out for you. So I'm hoping that we can get a webinar up that gives all the fundamentals so that you can come right in to level 2 or 3, because we might be doing 2 or 3 in the winter and back to 1, subsequently.
I just showed it on the website. Same information, but has the information link here to go.
Thank you, Ellen.
Yeah.
Yeah, and it's 14 PDAs for Florida and for NCCAOM.
And this is their website up here.
Yeah, it's long, acutriggerpointseminars.com. And also, like, in the meantime, if you're really interested, you could look at Mark Seem's books. This is the tome. It's a 2-volume. I don't know if they still publish that 2-volume set. Dr. Travell and Dr. Simons. they've got volume 1 and volume 2, like the upper body and the lower body. And inside of here is like everything you'd ever want to know about where the trigger points are, what referred pain it's, what usually causes it, where the referred pain patterns are, and so on. So I find, and Mark Seem taught us, this is something you keep right at hand while you're working, because there's no shame. You're going to go and you're going to look it up. I've done it with patients, like, I want to just check what you're selling me, and see what I can find in the book. And there's so much knowledge here. So you want to have it at hand, and it's a great resource. But you're not going to read it to cover. You're going to use it in sections. Whereas Dr. Seam's book, you can. This is a pretty quick read. Okay. Well, it's been a pleasure. Thank you so much, Ellen, and thanks for.
Right. Yeah, thank you. It's fascinating.
Yeah.
All right.
All right. Okay.
Thank you very much.
You're
All
welcome.
right.
Thank
All
you.
All
Bye, you
right.
guys. All right.
All right. We'll talk to you later. Thank you. And we do have a recording, and we'll be posting it.
Great. Thank you so much,
Okay.
Ellen.
All right.
That was really great. Thanks for hosting us.
Sure. Thank you.
Bye.
All right. Bye.